look at you.
All right, we want to talk about Breast Cancer Awareness Month, and we have our big expert here, Dr. Brett Parkinson with Intermountain Medical Center. And thanks so much for coming in. First of all, I just remind everybody, what about the guidelines? When do you need to get your first checkup?
The guidelines have really not changed. In spite of last year's task force recommendation, the guidelines are still, beginning at age 40, women of average risk should start yearly screening mammography. And they should screen for as long as they're healthy. Now, as you know, the task force guidelines came out and said that it wasn't necessary between 40 and 50, but they didn't look at some very important data. And they included 2 studies in particular that were flawed. And since they didn't have any experts on the panel, I don't think they were aware.
Just ignore it and go at 40.
I think 40 is the best thing to do.
What about, and baseline, that you get your very first one at 40?
You get your very first one at 40, unless you have a family history of a first-degree relative with breast cancer premenopausally. So if your mom had breast cancer at 38, you can start at 28.
Okay, so you should start 10 years before they were detected.
Exactly.
Okay, and I guess early detection is so key still in beating breast cancer.
Absolutely. If we can find a breast cancer while it's still within the duct and has not invaded what we call the basement membrane, the cure rate approaches 100%. That's called ductal carcinoma in situ. And mammography strength is in finding cancers of that particular type. Now, in younger women who haven't started screening, it's very important that they are aware of their breasts and that they continue to perform self-breast examination. As you know, the task force said they really didn't have any evidence that that was helpful. But I can tell you, as a practicing clinician for the last 20 years, many women who have come in have found their own breast lumps and have saved their lives because of that self-breast exam. So continue to examine your breast and have your doc examine your breast as well.
It might not show up on a mammogram. You might feel because it's different. It's an abnormality.
Never ignore an abnormality in the breast.
Get it checked.
Get it checked.
You guys can do the different tests.
Well, we can do mammography, we can do ultrasound, and now we have breast MRI, which is a very powerful tool. It's expensive, but it is very helpful in women who are at extremely high risk.
All right, Breast Cancer Awareness Month. You can learn a lot more by going to our website, connecttoutah.com, and support breast cancer research.
Thank you.
Thanks, Dr. Parkinson. We'll be back.